In this documentary we talk about viral diseases. Viral diseases are extremely widespread infections caused by viruses. A type of microorganisms. There are many types of virus that cause a wide variety of viral diseases. This occurs when an organism's body is invaded by pathogen viruses. An infection virus particles attach to and enter susceptible cells. We talk about two viral diseases, influenza and cancer. This is the influenza virus is an infectious disease of mammal caused by a type of RNA virus. It is one of the most viral diseases in humans. Below, we give more information on the disease.
The HIV is caused by infection. Each person is different, so a person may not notice any symptoms or may experience a brief period of influenza. As infection progresses, increase the risk of common infection like tuberculosis. HIV is spread primarily by unprotected sex and contaminated blood transfusion, etc. In 2015, 36.7 million of people were living with HIV, and it resulted in 1.1 million of deaths. Most of those infected live in Africa. Between its discovery and 2014, HIV has caused an estimated 39 million deaths worldwide. There is currently no cure or effective HIV. Treatment consists of highly active antiretroviral therapy, which slows progression of the disease. The treatment also includes preventive and active treatment of opportunistic infection. This is the basic that you have to know of this disease.
It's a contagious respiratory illness caused by influenza viruses. It can cause mild to severe illness, serious outcomes, or flu infection. Can result in hospitalization or death. Some people, such as older people, young children, and people with sure health conditions, are a high risk for serious flu complications. How flu spreads? Most experts believe that flu viruses spread mainly by droplets made with people with flu, cough, sneeze, or tal. These droplets can land in the mouth or noses of people who are nearby. Less often a person may also get flu by touching a surface or object that had flu virus on it, and then touching the wrong mouth, eyes, or possibly their nose. Symptoms. People who have the flu often feel some or of these symptoms: fever or feeling, cough, sore throat, runny or stuffy nose, morcille, variax, headaches, fatigue, tiredness. Some people may have vomiting and diarrhea, though it is more common in children than adults. Onset of symptoms. The time from when a person is exposed to flu varies to when symptoms begin. It's about 1 to 4 days with an average of about 2 days.
Now we'll talk about cancer. Cancer is the name given to a collection of related diseases In a types of cancer, some of the body cells begin to divide without stopping and spread into surrounding tissues. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. Normally, human cells grow and divide to form new cells as the body needs them. When cells grow old or become damaged, they die, and new cells take their place. When cancer evolves, however, this orderly process breaks down, and cells become more and more abnormal. Old or damaged cells survive when they should die, and new cells form when they are not needed. These extra cells can divide without stopping and may form large-scale tumors. Unlike malignant tumors, benign tumors do not spread into or invade nerve tissues. Benign tumors can sometimes be quite large. However, when removed, they usually don't grow back, whereas malignant tumors sometimes do. Unlike most benign tumors elsewhere in the body, benign bright tumors can be life-threatening. Finally, we have an interview with the radiologist, Dr. Ruiz, to tell you things about cancer. The Centro de Radiodiagnóstico e Imagen, and we are about to have an interview with the Dr. Eustragio Ruiz. He is a radiologist, and we are going to ask him about cancer.
Okay, here we are at the interview with Eustragio Ruiz. He's a radiologist, and we're going to start with the questions.
What are you used to in your job?
Well, my job is about diagnostics. I make diagnostics by imaging. There are a lot of types of imaging. We have MRI, ultrasound, CAT scan, and simple radiographies.
Okay. And are you used to treat people with cancer?
Yes, almost every day.
Did you used to investigate about cancer?
Yes, well, even since my school days, we used to do a lot of studying about cancer. Every system in the body has some kind of cancer.
Okay. And do you know any symptoms? Maybe one or two symptoms?
Yeah. The principal symptom of a patient with cancer maybe the loss of weight.
Lost of weight.
Loss of weight. And the people used to feel very tired all the time. And they stop eating. They diminish hunger.
Okay.
And are there any preventions?
Yes, they are, but it depends on the kind of cancer you want to prevent. For example, skin cancer you can prevent it by using some blocker. For example, patients with you want to prevent stomach cancer, you can prevent it by not eating a lot of certain kind of foods, organic food, junk food or smoking. Smoking
Okay.
can prevent almost every cancer. And I mean it depends on the cancer you want to prevent.
Okay. And are you used to apply all this kind of preventions in your daily life?
Not in every type of cancer. For example, I eat a lot of red meat, and it's supposed to, if you increase your red meat amount of eating per day, your risk of develop, for example, colon cancer can increase. But I mean,
Okay.
not all types of cancers.
Okay. And are doctors used to know when someone has cancer?
Yeah, They can, how can I say, have some suspicions of cancer. But first, we, the doctors, I do the diagnostic, but the clinic and the clinicians or the physicians, they have the suspicions, and then they refer their patients to us for an imaging study, and then we try to locate the cancer.
The cancer. And does cancer used to reappear in someone? Like sometimes it's gone and then it comes back. It comes back.
Yes, every cancer has a rate of recurrence. It depends on the type of cancer. I mean, not all the cancers have the same aggressive progression. So, for example, pancreas cancer is very, very aggressive and used to reappear almost every time.
So you have to be careful every time.
Yeah. Well, if you survive.
Okay.
It's very difficult to survive.
Okay. Well, thank you very much. This is Dr. Reese. He's a radiologist in Radiodiagnóstico e Imagen.